a national African American breast cancer survivor organization. Ms. Munnerlyn is a 24-year breast cancer survivor. She is also a founding member of the Friends of the James Brown African American Room. Please join me in welcoming Dr. Maisha Amin and Ms. Charlotte Munnerlyn. Thank you.
Good evening. I'm Charlotte Munnerlyn. I am going to be introducing Miss Asia Smith. She is a national recognized domestic violence specialist and advocate with nearly 20 years of experience. She is the domestic violence specialist for the City of Newark and the Public Safety Department. Ms. Smith's accolades and achievements are vast and highly impressive. Some, but not limited to, are appointment to the Governor's Advisory Council Against Sex Abuse, where she is currently the chair. She is also lethality and danger training from Johns Hopkins School of Nursing, forensic research analysis, and training to the judiciary. These are just a few of her accomplishments and duties. She has appeared in print and national broadcast outlets. Ms. Smith's professional goals are obtaining a doctorate degree in forensic psychology and publishing safety resources for victims, survivors of domestic violence. I would like to present to you Asia D. Smith, Domestic Violence Specialist at the Shani Baraka Women's Resource Center, Office of Violence Prevention.
Hi, good evening, and thank you so much for the introduction. And I would like to begin by thanking the Newark Public Library, the Friends of the James Brown African American Room, to all of you that are on tonight that are sharing this space with us, to the many advocates that I work with, some that I see, my good colleague, Darina. And I'd also like to thank Mayor Baraka, the City of Newark, the Public Safety Department, and of course, the Shani Baraka Women's Resource Center. I would like to just start off by saying that it is imperative that we acknowledge the dangers of domestic violence during this time of isolation and how stay-at-home mandates pose a unique set of challenges for not only victims of domestic violence, but for advocates as well. Domestic violence advocates across our state and nationwide have growing concerns that confining victims with their abusers can potentially intensify violence and have devastating consequences. Now, we understand that even in healthy relationships, it can be challenging to be confined in close quarters with others for an extended period of time. And so for individuals in abusive, unhealthy, violent relationships, those challenges are amplified drastically. And so again, unfortunately, this is a highly stressful time, as we can all attest, for all families, particularly those considered the most vulnerable among us. And as the latest data around the pandemic suggests, the most marginalized are also the most impacted. And so now for victims of domestic violence, not only does COVID-19 force people to stay indoors, it halts plans of relocation, compromises safety, and impacts victim survivors' ability to escape. The urging of social distancing and federal mandates put victims in close proximity to abusers and has the potential to exacerbate risk of domestic violence or intimate partner violence significantly. And so one of the things that I want to do, pardon me, is to really, I'm going to share my screen now, and I'm going to just talk about some statistics, because before we can really go into how COVID impacts victims of domestic violence, I think it's really imperative that we talk about and educate ourselves on precisely what domestic violence is. So I'm going to just share my screen. Okay, are you all able to see my screen okay?
Yes.
Okay, perfect. So I'm going to just increase the slideshow. And so again, thank you all for this time. My presentation is really just going to talk about a crisis within a crisis. And I also just want to make one small correction. I am the board chair for the state of New Jersey's Domestic Violence Fatality and Near Fatality Review Board, but I also have a gubernatorial appointment to the Governor's Advisory Council Against Sexual Violence. And so the reason why I wanted to just make that distinction is because my role in that capacity is really what is going to inform this presentation for tonight. Okay, and so there's a quote that I really like, and it's by Norman MacLean, and it says, "It is those we live with and love and should know who elude us." So now, what is domestic violence? You know, most people talk about domestic violence. They say, oh, it's this, oh, it's that. But the first thing we really want to point out is that it's a crime. It's a crime before it's anything else, because typically we hear folks that try to minimize it because they're not really sure about what it is. But the crime of domestic violence is the occurrence, or it means the occurrence of the following acts: homicide, assault, terroristic threats, kidnapping, criminal restraint, false imprisonment, sexual assault, criminal sexual contact, lewdness, criminal mischief, burglary, criminal trespass, harassment, stalking, criminal coercion, robbery, contempt, and other crimes, any other crime involving risk or death or serious injury, serious bodily injury, So the other thing that I want to say is domestic violence, I call it three things. It's willful, it's insidious, and it's a pattern. It is the willful intimidation, the physical assault, battery, sexual assault, emotional, psychological, verbal, and or other abusive behavior perpetrated by an intimate partner, family member, caregiver, ex-partner, or household member. It is the insidious and intentional breaking down of a person from the inside out. It can be as subtle as an unkind word or as blatant as a slap in the face. And then I'd like to also point out that it is a pattern of abusive behavior that's used by one person to gain or maintain control over another person. It typically begins with name calling, jealousy, and criticisms. Then it escalates into slaps, punches, strangulation, rape, and possibly even death. And so most people, again, when we talk about domestic violence, they often see it from just these particular forms of violence: verbal, emotional, mental, physical, sexual, financial, and spiritual. But there's another form of domestic violence that we like to really point out that really gives us some context as to how these abusive relationships actually begin. And there's coercive control is something that we really like to point out and highlight. I'm not going to read everything because in the interest of time, but we really are going to talk a little bit more about coercive control and how that creates a lot of challenges for victim survivors. And so some of the tactics that we see in coercive control relationships are unreasonable demands, degradation, restricting daily activities, threats or intimidation, the financial control, monitoring a person's time, taking away their phone, restricting mobility, depriving a person of food, medication, or contraceptives, and destroying property or possession. And so these are things that, as I want to point out, are done independent of COVID, okay? And so another form of coercive control would be like gaslighting. And so usually it's like, oh, that didn't happen. And if it did happen, it wasn't that bad. And if it was, then it's not a big deal. And if it is, it's not my fault. And if it was, I didn't mean it. And if I did, it's because you deserve it. So there's that whole psychological aspect of how domestic violence actually occurs. And so these are just what it sounds like. And so I'm not going to go over all of these things, but as you guys can probably see from the screen, that these are behaviors and activities that all impact a person psychologically. And so one of my colleagues on the board, Dr. Cynthia Lishik, works very closely with a gentleman by the name of Dr. Evan Stark. And I'm sure if you haven't heard of him, he does a really great lecture, and he's written a wonderful book on coercive control. And so they point out that intimate partner violence or domestic violence is a course of conduct involving a pattern of psychological and behavioral tactics woven together, extending through space and time, intending to achieve and maintain power and control coercively over an intimate partner in order to deprive that partner of their civil rights to safety, autonomy, independence, creativity, and liberty. And so it goes beyond just the name calling. Of course, there's the isolation, coercion, manipulation, and all forms of physical violence. Next slide. And so when we talk about domestic violence victims, I'm sure we've all heard a lot of these myths and misconceptions, unfortunately, particularly around abused women. They're weak, abused women are stupid, must not be that bad, or she'll be back with them. How could she not know? Why doesn't she just leave? Is typically the biggest question that we often hear. And then when we talk about how women of color or African-American women are impacted, take those particular myths and misconceptions and you add to that how women of color are typically pathologized as psychologically unhealthy, or we're angry, typically dishonest or vengeful. We have a higher tolerance for pain. And so if we do get hurt, we don't really feel it. And more importantly, we're really strong, superhuman even, and don't need the help, even if we are in dire need. But now when we talk about victimology, I really just want to point out that anyone can be a victim of domestic violence. There is no typical victim. Victims of domestic violence are from all walks of life, varying age groups, all backgrounds, all communities, all education levels, all economic levels, all cultures, ethnicities, religions, abilities, and lifestyles. Victims of domestic violence do not bring violence upon themselves. They do not always lack self-confidence, nor are they just as abusive as the abuser. And violence in relationships occurs when one person feels entitled to power and control over their partner and chooses to use abuse to gain and maintain that control. And so in relationships where domestic violence exists, violence is not equal. Even if the victim fights back, acquiesces in an effort to diffuse the situation, is accused of instigating or causing the violence, or recants, there is always one person who is the primary constant source of power, control, and abuse in the relationship. And so I really just want to point out some statistics as it relates to victim survivors. And so when we're talking about women of color, Black women between the ages of 25 and 44 are 3.5 times more likely to be murdered than women of other races within the same age range. African American or Black women are at a far greater risk of experiencing the most egregious forms of domestic violence when compared to other groups. And so again, I'm not going to read all of this, but I want to just highlight here how higher rates of domestic violence in the African American community are strongly related to higher levels of poverty, economic oppression, and community violence. And so last but certainly not least, African American victims of domestic violence are more likely to be killed by their partner if there had been incidents in which the partner had used or threatened to use a weapon and or non-fatal strangulation. And so when we're talking about in the Latinx community, due to barriers like anti-immigrant laws, Latinas are half as likely to report abuse versus survivors from other ethnic or racial groups. And 63% of victimized Latinas experience multiple acts of victimization. And so I really just want to talk about the scope of intimate partner homicide. Again, that is my area of focus in terms of domestic violence, intimate partner homicides. And being on the Domestic Violence Fatality and Near Fatality Review Board, we analyze the domestic violence homicides here in the state, and we look at some of the things that were or weren't in place, or some of the preventative measures that could have been taken to possibly have prevented those homicides. And so Voltaire has a quote that says, "To the living we owe respect, but to the dead we owe only the truth." And so when we're talking about homicides on a national basis, about 94% of females that are murdered are killed by a male they know. 50% of murdered women are killed by an intimate partner. Nearly 5% of male murder victims are killed by an intimate partner. And 1,200 Americans die in murder-suicides each year. In 3 out of 4 murder-suicides, an intimate partner of the shooter is among the victims. And then when we're talking about how pregnancy and violence are coexist, homicides were the leading cause of death during pregnancy and the first postpartum year, Women who were African American or younger than 25 years and unmarried were at the highest risk for homicide. So now let's talk about New Jersey, where we are. About 9.4% of all homicides in New Jersey were due to intimate partner homicide. And in 45% of the murders of a woman by a man, a precipitating factor was the victim's attempt to leave her abuser. Okay. And so, in a third of the cases that we analyzed from 2016, 2017, and 2018, 135 of those, the perpetrator committed suicide after killing the victim. And so, I'd be remiss if I didn't talk about domestic violence in Newark. And so, Newark has the highest number of shootings and the highest number of reported domestic violence incidents of any city in New Jersey. Newark has amongst the highest number of domestic violence fatalities and requests for restraining orders in the state, just so that we could put some context around that. And so, and I'm pretty sure my colleague Dorena can point out as well that a lot of the barriers and the contributing factors that many victim survivors are met with is just systemic oppression, the inaccessibility or the lack of culturally specific services, racial and cultural loyalty, spiritual religious beliefs, economic instability, and protective factors all contributes. And so what do those barriers really look like? And so here are just a list, a few of them. Number one is the normalizing. We have become so desensitized, unfortunately, and so we're socialized sometimes to even ignore some of the hitting abuses, or we rationalize the abuse. There's the fear of death and reprisal, the fear of losing custody, the fear of deportation or arrest, fear of death, even by law enforcement, the exposure to the criminal justice system, being blamed or disbelieved and discriminated against. A distrust, again, in law enforcement, the judiciary, social services, and medical services. Victims just don't feel safe in reporting, and just the constant reoffending or the stalking and threats by the defendant really plays a tremendous amount of, it has a tremendous impact on when victim survivors leave. And so I want to just point out too on this next slide is that abusive behaviors and tactics are just what they are. It's not about gender. More often than not, we hear, oh, it's women and it's just, heterosexual relationships, but it is not that at all. And so these are just some of the tactics that I wanted to just highlight in terms of how domestic violence actually happens. And so I'm pretty sure if you all are looking at the screen, these are some things that you may have heard from other victim survivors, or you may have experienced something similar yourselves. And really not realize just how significant those behaviors are. The next, we see a few more. These now are when things start to escalate into physical violence, stalking, the use of weapons, threats, intimidation, etc. And so I'm just going to skip past a lot of these risk factors, but I just really wanted to highlight to say that by understanding risk factors such as non-fatal strangulation, for example, where a victim is 10 times more likely to be killed by her partner once she has been the victim of her partner's attempt to strangle her, we are better able to identify at-risk individuals, provide opportunities to intervene, and offer victims adequate safety planning. And so just again, some lethality factors, I just want to point out, because most people, again, as I mentioned earlier, some of the misconceptions are, why doesn't a victim just leave? Well, what we've noticed shows without a doubt that separation is the most dangerous period in time for domestic violence victims. And 75% of all domestic violence homicides are committed after a victim leaves. So that's after a person has obtained a restraining order, after a person has decided they wanted to move on and be happy. It's after that. But then we also just want to point out that it takes a victim between 7 to 13 times of abuse before they can even leave a relationship. And so, again, we think like, well, it must not be that bad, or why doesn't a person just leave? Leaving is a process, and we have to do it safely and strategically. And again, we're talking about firearms and how those really play a significant impact in homicides. Strangulation, again, is something that we really want to point out. We often hear victim survivors use the language of choking. We really just want people to understand the distinction between choking and someone actually strangling an individual, okay? And so other known domestic violence risk factors that increase homicide or intimate partner violence, reoffending, again, is when guns are available, strangulation. We look at previous hospitalizations, the perpetrator's violent history, and any changes in escalation in a partner's, in the relationship when the partner's control. And so again, we look at those periods of separation, the stalking, including the cross-jurisdictional travel to threaten or harass, threats of homicide or suicide, depression or other mental illness, obsessive attachment to a victim, abusive pets, drug and alcohol involvement, antisocial lifestyle, and past criminal behaviors. Okay. And so just something that I really just wanted to illustrate. Again, I am a proponent on just showing what these numbers actually look like. And so when a person is threatened with a weapon, they're 20.2 times more likely to be killed. There's threats to be killed. Look at how these numbers increase significantly with their strangulation, constantly violently jealous, forced sex and rape, control over an individual's daily activities, etc. And so I just really want to, again, highlight that escalation and how domestic violence is a pattern. And so separation is the most dangerous time. And so most domestic violence victims do not call the police or use court remedies. And so we want to highlight this information because as family members and friends, we're oftentimes, we want to get involved. We want to help those that we love, but we want to make sure that we're equipped properly to do so, because again, someone may come to you all as opposed to actually going to the police or even to the court. So not all domestic violence is the same. We have to highlight that. Battering is contextual over time, and the response of domestic violence must be coordinated and continuous. You know, more often than not, we see a lot of organizations and agencies working in silos. And I like to tell people that silos do a disservice to our victim survivors, because the more resources a person has, the better and the more successful they will be in terms of leaving. Now, I know that we're really pressed for time, and I know I'm sure I have to wrap up, but I just wanted to just kind of highlight some safety features really quickly for anyone that's on the in the meeting that wants to share this information. When an argument begins, try to move to a room or an area with a safe exit. We want to have people avoid bathrooms or kitchens or anywhere near a weapon. And I know that more often than not, particularly in certain communities, we are taught that what goes on in this house stays in this house. But we have to also identify a neighbor or someone that we can trust that can call the police or intervene safely on our behalf. And so I'm going to skip that. Again, setting safe boundaries is always imperative. We have to implore all victim survivors to please consult with a trained domestic violence advocate, develop a safety plan, keep those plans to yourself. We have a lot of victim survivors that oftentimes want to say, well, I'm leaving and I'm going and I'm taking and I'm doing. Let's just keep that to ourselves and get out safely, and always, always trust your instincts. Okay. And then towards the end, I know we'll talk about some resources, and I'll be more than happy to come back to the screen and share some mental health resources and additional domestic violence services that are in our community. Thank you.
Well, thank you very much for that informative and well-presented presentation. Thank you very much. And I'm sure that our listeners have enjoyed and have, and are happy to get the information that you have given to us.
Yeah, thank you. This is Dr. Amen for that informative presentation. And also just wanted to highlight just a couple of things. One of the reasons why we wanted to do this program was because of the, and the experience that we're having with COVID, with the isolation, with the stress, and with the financial burden. And those are some of the factors that contribute to the higher rates of domestic violence that we're seeing this time. And then the other thing that I just wanted to mention just quickly was that when I taught nursing school in New York, there was a student who was 2 weeks from graduating from college, and her husband killed her. And he killed her because he didn't know she had, she had hidden the fact from him that she was going to school because she knew that, she needed to become financially more stable so that she would be able to take care of herself and her children. And when her husband found that out, he killed her. He killed her 2 weeks before graduation from nursing school. So, and with that, I want to introduce our next speaker, who is Mrs. Darina Johnson, who is the program coordinator of the Safe House, a haven for individuals and families affected by domestic violence. Mrs. Johnson was born and raised in Newark and has been an advocate for survivors of family violence for over 17 years. Some of the services that she has provided is the Family Justice Center Advocate Support Group, Case Management. And with that, I'd like to welcome Ms. Johnson to our program, and she will take it from this point. Thank you.
Thank you. Thank you so much for having me. And we look forward to any time that we can shed a light on domestic violence, to end domestic violence, and to provide information to the community that we serve. So I'll start by talking about the Safe House and our role in the community, and then I will share my screen so that I can continue further from there. So the Safe House is a domestic violence program where we provide information, referrals, safety planning, referrals for legal services, victim advocacy, all under one roof. Our Safe House has a domestic violence hotline, which is a 24-hour domestic violence hotline for people to call in and get information. If they need shelter, we will screen for shelter. We will make referrals if they need for legal services, for criminal justice services. As part of our agency, for the residents who reside in the shelter, we provide safety planning. We give them phones if they need a phone. We provide counseling and therapy for them. And we also provide some transportation services and referrals for other social service agencies that can provide referrals for things that we do not provide inside our shelter. So we also have community partners. We have an advocate in the family court who provides legal services for survivors of domestic violence inside the court. She does safety planning and explains the court processes, and also provides advocacy in court as well as accompaniment during restraining order hearings. We have counselors that provide bilingual counseling at the Family Justice Center. And we also do community outreach and education and information. I'm going to start sharing my screen here. Okay, let's see. Okay, can everyone see the screen?
Yes.
Okay. So I'm sorry.
Just put it inside show, if you like.
Thank you.
And from current screen.
Everything looks good?
Looks good.
Okay. Okay. So, okay, I'm sorry. Let's see if I can go back. So I'm going to focus on safety planning during this presentation. What is safety planning, and what can a person do to be safe? Safety planning is having a personalized plan to increase safety, to reduce the incidence of violence, and it's also being prepared in advance should there be a need to leave an emergency. Once you realize that you're in an unsafe relationship, it's up to you to decide how you want to move forward. And obviously that will look different for every person. For some, it's staying in the relationship is best. For others, they may want to leave the relationship and find a way to leave in the safest way possible. When creating a safety plan, we have to ask the following questions. How can I be safe at home? So if an abuser has moved out, or the person who is a survivor decides to stay in the home, we always suggest that they change the locks, that they use door and window alarms, that they change their phone numbers and all passwords to their computers, to their banking accounts, to anything that the abuser may have access to. We ask that they plan their escape route if their abuser should get into their apartment. We ask that you have a bag ready and already packed and know where you would want to go or where you plan to go if you have to leave your home. Consider a restraining order, file a police report. This will help create a paper trail, and also to help you have documentation in case there's other acts of violence that have taken place. For people who still live with their abusers, sometimes it's very hard to leave, and it may not be an option leaving at the moment. So if a person is living with their abuser, we try to have them de-escalate, as my colleague Asia mentioned a few minutes ago, move to a safer room, such as the living room or a bedroom, because it's away from heavy, dangerous equipment such as knives and things of that nature. And also it's very important to know the agencies in your community that can help with different things such as relocation services, counseling services, and some of those resources will be provided later in the presentation. But it's always good to know what agencies in the community that are able to help. Okay. Okay, it's not moving to the next slide. Sorry about that. Okay. How can a person be safe at work? Consider how and what to disclose to a coworker or management should your partner show up at your job, because we know that women obviously have to take care of themselves, and this goes for men as well, because obviously domestic violence is not gender specific, and there are victims of all walks of life, and it doesn't, there's no male or female or anything like that. Domestic violence is domestic violence. So we always ask people to make sure someone else is aware that they're being stalked or followed, or if someone, a lot of times abusers show up at their job. So we always advise to have a safety plan for work. Make sure that they tell someone that someone is following them, or they may need to have some extra help. Try to change the route to and from work if possible. Or in some cases, people are able to get a transfer to another job site. Inform security that's available, because sometimes they can escort you to your vehicle. That's one of the things that some people employ to be safer at work. And also keep records of any phone calls that you may receive at work. It's important for survivors in unhealthy relationships to report violations if they have a restraining order. Because the abuser can then be arrested if they violate a restraining order. In addition, to ask for a leave of absence if that's financially feasible, or paid time off while you seek a restraining order and do other things that have to be done. A lot of times, in my experience, people are not aware of what their rights are as far as employment. And they're not aware that they can actually get time off from work if they're having to go to court, or if they need a leave of absence to take care of family matters and get themselves to a safe place. And also know the laws that protect you and the rights that you have as a victim or survivor of domestic violence. How can a person stay safe in the community? One option is to keep, well, this is not an option, this is really a necessity. If you do have a restraining order, we ask that you keep a copy of the restraining order at all times. If you're stopped on the street by an officer and an abuser is harassing you, having that restraining order will ensure that justice will be served. And again, as I mentioned earlier, an abuser may be arrested on the spot if you have your restraining order and they're violating the restraining order. Avoid mutual places and people when it's unsafe. A lot of times, even in my experience in shelter, we have families who are in shelter, but they continue to go to the same family members' homes. They continue to go to the same stores, to the same, visit the same people. And that's not always the safest option because a lot of times abusers are familiar with the people and places that we frequent. And we also suggest changing up the routine travel habits, including your banks, the stores that you shop in, as I said, friends and family members that you frequent. It may be safer to kind of not do those things for a while until you're in a safer place. If you must meet with your abuser, for example, if you have children in common and you have visitation, we just ask that people do it in a safe place, a public place, a police department, somewhere where that it would minimize the abuser battering them or harassing them or causing physical damage. We also suggest that people turn off their location services. Sometimes this is forgotten, and it's very important, especially for people who choose to go into shelter, to turn off the location services to limit their abuser finding out where they are. In some cases, when there's physical abuse and a person has to go to the doctor, or even for a routine physical, sometimes abusers have a tendency to travel with their partners to the doctor. We always suggest that, and a lot of victims should know that they're able to talk to their doctor in private if they choose to do so, to let them know that they're being abused. And they can also talk with them about services that might be available to them if they need to leave the relationship. So in the next slide, I will talk about how to cope when dealing with abuse. Of course, during this time of the pandemic, it's difficult for people to leave their homes. And I'm sure there are a lot of families that have been stuck at home with their abusers. We always suggest to try to talk to a friend or someone in your circle who knows you and knows what you're going through, that can be a listening ear and also offer some sympathy. And if you're a friend, be sympathetic, listen without judging, and enable that person to have someone that they can talk to and get help that they need. We suggest that they seek counseling from an agency that gives trauma-informed services. And to learn and practice self-care, finding time for yourself, try a new hobby, something that brings you joy, to give you a moment of peace. If you're not able to leave, try something that will help you to feel better, even though you have to be inside. Pick up or rediscover a hobby: journaling, poetry, knitting, sewing, drawing, anything that you can do to occupy yourself and give you some space. Sometimes moving away is best, understanding that, of course, it may not be easy to do this, but for some, that's an option. And this is one of the reasons why shelter is available for people who cannot stay safely in their home and need a better place to go, safe place to go. Options should you decide to relocate. So as I mentioned, going into a domestic violence shelter. In New Jersey, there's a domestic violence shelter in every county. A person has the option of relocating out of town or out of the state. Just ask for some help if there are children involved, because a lot of people leave the state without acknowledging or notifying the other parent that they're leaving the state. And so it's very important, if someone is leaving an abusive relationship, to let the courts know that you're leaving the state, because you may have to have permission for that. Also, something that people may not be as familiar with is the address confidentiality program. This program is part of a larger safety plan, which addresses the mail, and also it protects documents such as not restraining orders. It protects documents such as your motor vehicle documents, and it enables people to use a separate address that is not their current living address for their mail, for their important documents. and also to put another barrier in place to separate themselves from their abusers. And also to seek help from a domestic violence program. Obviously, having a personalized safety plan is important. And if people call the resources in our community, they're able to speak with an advocate directly who can talk with them about creating and maintaining a safety plan. And also to help advocate on your behalf if you need to access another state's domestic violence program. So I'm gonna, in the next slide, list some community resources. And these, because this is being recorded, people can have access to these phone numbers and other phone numbers. We have the Safe House, Sylvia's Place, which is another domestic violence shelter in Essex County. There's the Real House, which is also provides shelter for victims. They offer counseling and support services as well. The Salon, which is a domestic violence program for survivors of domestic violence living with HIV/AIDS. The Essex County Family Justice Center, which offers legal, criminal justice advocacy. They offer counseling and other services all in one location. A similar agency, as we know, is the Shani Baraka Women's Center. They also offer counseling and support services, and they also have criminal justice on site where survivors can access police reports and also get help with restraining orders and special services because it's a special victims unit. The Rachel Coalition, which provides legal services. Partners for Women in Justice, they also provide legal services. My Sister's Lighthouse, which offers counseling and support services to survivors. Sophia, which is a domestic violence agency that provides counseling and support services. They also serve youth who are may experience domestic violence. They also offer educational support programs for youth. Excuse me, Family Connections, which offers therapy, including therapy for the parents and also the non-offending parents, and therapy for children who have witnessed domestic violence. Excuse me. La Casa de Don Pedro also offers counseling and support services for survivors of domestic violence. The Essex Newark Legal Services Agency, they provide legal services, including divorce, restraining order hearings, and housing. The Victim Witness Office, which is part of the Criminal Justice Services, they have a victim witness office that provides advocacy, information, and criminal justice services. And then for relocation assistance, we often go to the Victims of Crime Compensation Office. So those are some of the community agencies that provide services to survivors of domestic violence. So that's the conclusion of my portion. And okay, here we go. I'm just going to close this screen. And once again, I thank you for this opportunity to share community resources and to talk about programs and services that are available to members of our community.
Thank you, Ms. Johnson, for your very informative presentation. Because we understand that it's very important for people, for victims of domestic violence to have some sort of begin to think about some sort of safety plan so they can begin to think about ways to place themselves as well as their children, their other family members in a safe kind of environment.
Yes.
And you have to have that thought on your mind in order to be able to execute. So
Exactly.
that's a very important first step in someone, coming out of that situation, unhealthy situation that they find themselves in. Thank you. And thank you also for the list of resources that are that you made available. And one of the resources that you spoke about was Partners for Women and Justice. which empowers low-income victims and survivors of domestic violence to build safe and secure futures for themselves and their children by providing equal access to justice. So it's looking at final restraining orders, looking at issues related to domestic violence, including safe visitation, custody, and child support. So, so those are some vital services. And one of the things, as we well know, is that many times one of the primary reasons why people find themselves staying in that situation is because they lack information, they lack the financial resources. So having those services available to them, especially at low or no cost, is vitally important. So thank you. We thank you so much. So at this point, I think that we can entertain a couple of questions.
Sure, yeah. I see some questions in the chat. If I can present them to our panelists, may I do that, Doctor?
Yes, ma'am. Thank you.
Thank you. Sure. The first question, what's the name of the legislative act that protects victims from being evicted or fired? And if we don't have these answers, we sure at the library will try to provide this and post this on our Facebook page. But again, what's the name of the legislative act that protects victims from being evicted or fired? Might anyone know that?
It's, I believe they're talking about VAWA, and that's the Violence Against Women Act. And I'd highly recommend everyone to familiarize themselves with that because there are protections, particularly around evictions. However, there's a process that victims and survivors must comply with, but it is absolutely the Violence Against Women Act. I'm not sure, Delrina, if you know of anything else, but once they said act, I just automatically figured it was that one.
And just to add to that, for the, it was mentioned about being fired. If the person goes to the Department of Labor website, there's a lot of information about employment security and getting that family. I think the Family Medical Leave Act is what protects them against being fired from their job for missing work. But again, as you said, people do have to be forthcoming with their employers to let them know that something is going on. They can do it after the fact, but it's a lot easier if it's done ahead of time, if they know they're in an abusive situation.
Thank you. I hope that helps the person that asked that question. Another question, how would you address a family member who is intimately aware that their loved one is in an abusive relationship, but has not proactively addressed it? Anybody?
Use Dorina first.
I can start out, yes, by just saying that, of course, we have to be listeners, good listeners, and we also have to be non-judgmental. Sometimes the person is not always able or willing to leave the relationship. In the work that we do, we understand that it takes 7 to 13 times for a person to finally make the decision to leave. But until then, we provide support, we provide information, we provide encouragement. Safety planning, of course, is very important because if you're not ready to leave yet, at least be safe until you're able to leave. So those are some of the things that a family member or friend can do to support someone that they know is experiencing domestic violence. Because sometimes if we push too hard, they really won't do much or may choose not to do anything at all. But if they know we're there and we're supporting them, it makes it a lot easier.
And if I may, to just echo Delrina's sentiments, to also be discreet about it, be compassionate and discreet, because more often than not, we come from a place of emotions, we're attached to folks. And so if someone is aware of something, I would also just recommend that the person become acclimated again with the services that are in the community, with some of the resources. So when the conversation does arise, at least you'll have some answers to provide that person in a safe manner. But also, we like to just kind of inform family members and friends is that leaving is a process. And so we don't want folks to get frustrated because they feel as if the individual isn't listening or they're not leaving or they're not moving out fast enough. But in reality, how many of us can actually pack up and move anywhere within a matter of 2, 3 hours, or even a matter of days? And so, we want to make sure that we are supportive and in a non-judgmental way, but also be very discreet because sometimes batterers or perpetrators can even threaten to harm family members and friends who intervene. And so we just want to keep everyone safe and to do it in a manner in which it does not disempower a victim survivor.
Mhm. Thank you. Thank you. Another question that's related to an earlier question: what can a person say to an employer who says that her or his abuse constitutes danger to other employees? Harm could come to his or her coworkers.
It's true, it can, but I personally don't believe that an employer can fire someone simply because it's not their fault that they're being abused. And again, you do have rights. And if you're fired because you're a victim of domestic violence, that is discrimination. So the only thing I have to say about that is that unfortunately, you can't be 100%, you can't guarantee 100% safety even at your place of employment, because these abusers and perpetrators are crafty, they're sneaky, and you don't know, you can't predict what can happen. And an employer, like I said, does not have the ability or the right to let someone go simply because they're being stalked or they're bringing danger, because they're not the ones bringing the danger to their workplace.
Mhm. Yeah, thank
Yes,
you.
exactly. Mhm.
Yeah.
No, I just wanted to, if I may, and that was the whole purpose of, in the beginning of the presentation, I wanted to point out that domestic violence is a crime. And so what frustrates me and many of my colleagues is that the onus is always put on the victim, as if it's their fault that a person is doing this, as if they are the cure and the cause of someone's violence. And so, and the other thing too is that is one of the tactics that abusers will use. They will, when we're talking about that economic or financial abuse, is getting someone fired from their job, harassing employers, things of that nature. And so we would hope that an employer would research that VAWA Act, first and foremost, the Violence Against Women Act, but then also be more sympathetic and understand, perhaps as Delrena's presentations showed, maybe put in a transfer. I can recall having a situation where I analyzed the homicide, unfortunately, of a young lady who worked at a very prestigious Fortune 500 company, and so did the abuser. And this young lady did not want to go to the police. She didn't even want the abuser to be fired. She had requested to be transferred to another department, transferred to work in another location, etc. And so if there are opportunities or options like that, we would hope that those courtesies would be extended to a victim survivor to keep them safe. Because at the end of the day, the person who is committing the crime is the person that's responsible for those crimes.
Right. Absolutely. Yeah. We have a final question, and then we'll take some final thoughts from our panelists. And this may have been answered, but the answer is surely worth hearing again. What if the victim's abuser is aggressive in getting to them no matter what? What steps can be taken to secure the victim's hiding place?
Again, I'll repeat about the personalized safety plan, because it's very specific to your situation and your circumstances. You know your abuser best, And so it's important to speak with an advocate or a friend who can help navigate the systems, the agencies, the community service providers that, because again, it's a multifaceted process. Changing, taking off the location services, maybe entering a safe house. It may be taking the phone and just throwing it away, changing the passwords, changing the phone number. All those factors are things that can help the person stay safe. If the abuser is intent on getting to where they are, you have to take every measure that's open and available to you to help limit that. No, again, we cannot be 100% sure that that person is still not going to be injured. But if we work to personalize that safety plan and take every action that's possible that can safely ensure their safety, then every little bit helps.
Mhm. Thank you. Thank you.
you.
We have
No,
some closing remarks from Ms. Smith or Dr. Ahmed and Ms. Munnerlyn now. Thank you.
Well, in closing, I would just like to also echo Doreena's sentiments in terms of trusting your instincts. A victim knows their abuser better than anyone else. And more often than not, we will minimize, rationalize, and even deny some of the behaviors, but we want people to call it like we see it, and to also understand the risks that are in front of an individual. Become familiar with your local domestic violence services. If not, call the 800 number, 1-800-799-SAFE, and talk to someone. It's all confidential, and develop that safety plan. Each case is unique. And if a person is escalating, I know, again, we are not always too keen on going to the police, but sometimes we do have to exercise all of those measures and to stay safe. But again, there's safety in numbers. Always reach out to your local agencies, develop those safety plans, and do everything that you can. Be hyper vigilant and move forward safely. Thank you all.
Thank you.
Mhm.
Ms. Munnerlyn?
I just want to thank everyone who tuned into our program today. I hope that it was informative, that you take this back to your friends and families. I want to thank the panelists. I think they were superb. I also want to thank the North Public Library for hosting this. This is a very, very important matter, and hopefully you have learned and that you will just internalize it, and hopefully that you will pass it on. Thank you.
Thank you. Dr. Ahmed? Well, unmute yourself, please.
Thank all of our panelists. Thank everyone who've taken the time out of their evening to join us this evening. And I just also want to say that going back to Ms. Colson's opening remarks, that that not only the victim has been harmed, but even looking at the victimizer, because there is a deep healing that needs to take place in our communities. And I think that COVID not only causes, us to see this escalation of domestic violence, but I think that that's just highlighting a deep healing that has to take place within our community. And it not only involves people who are victims, but also the victimizers. So I think that, so I hope that, we will all take this information, but know and understand that there is work to be done on a number of different levels in order for this to not to be a problem within our communities as we move forward. And I thank you.
Thank you, Doctor. We hope that someone or many of us were helped by this program, and we thank you ever so. Thank you to Delrita Johnson, coordinator of the Safe House, Asia G. Smith, domestic violence specialist of the Shani Baraka Center, Ms. Charlotte Munnerlyn, and Dr. Amin. This program will be available for review tomorrow on the library's Facebook page and on the library's YouTube channel. We will also provide the resources shared by our esteemed panelists. Please join us on Tuesday the 17th for a program about colon cancer awareness in the Black and Brown community. And Thursday the 19th, our colleague Reggie Blanding will talk with author Maureen Mahone as they discuss her new book, Black Diamond Queens, which looks at the pivotal role of African-American women in the development of rock and roll. So thank you all for sharing. Thank you for your time. Please wear a mask and be safe. Thank you. Good night.
Good night.
Good night.